Hello everyone, good morning and a very warm welcome to my YouTube channel Target Nursing Officer. So today is January 1st, 2026 and we are starting our nursing exam preparation journey together. So this channel is specially created for the GNM, BSc Nursing and MSc Nursing students to crack the competitive exams. Here we will practice high-yield MCQs, previous year questions and important concepts from standard books like PR Yadav, Target High along with simple explanation. So my aim is very simple, to help you understand MCQ easily, avoid common mistakes and score maximum marks in exams. So today's class will practice 20 important MCQs which are commonly asked in every nursing exams. So keep a pen and notebook ready. So let's comes to the MCQs. So first question is the modern concept of the pediatric means. Option A, short-term care of the child. Option B, basic care of the child. Option C, continuous and preventing care of whole child. And terminal ill care of the child. So mainly option C is the correct answer. So mainly the modern concept of the pediatric, the focus is only in the prevention of the illness and promotion of the health rather than the treatment of the illness alone. So option C is the correct answer. So next come to the next questions. So which part of the brain controls and integrates activities of the autonomic nervous system? Option A, hypothalamus. Option B, epithalamus. Option C, midbrain. And option D is the thalamus. So option A is the correct answer for these questions. So let's come to the question number 3. So child can help in household chores, dressed and undressed at the age of 2, 3, 4, 5. So the correct answer is the 5. So at the age of the 5, the child can dressed or undressed. So let's comes to the question number 4. In development of the language, a child can tell story by the age of the option A 1 year, option B 2 year, option C 3 year, option D 4 years. Option D is the correct answer. At the age of the 4, the child can tell stories. Comes to the question number 5. Low recurrence in nocturnal enuresis is seen with which interventions? Option A is the desmopressin, option B is the oxybutynin, option C is the imipramine, option D is the bed alarm. So option D is the correct answer for these questions. Then comes to the question number 6. Yearly strict toileting can result in which condition? I repeat, yearly strict toileting can result in which condition? Option A, night terrors. Option B, temper tantrums. Option C, encopresis. Option D, nocturnal enuresis. So option A is the correct answer for these questions. Then comes to the question number 7. Which of the following milestone is a red flag sign in child development if not attained? Option A, walking at 12 months. Option B, talking single words at 12 months. Option C, social smile at 3 months. Option D, vocalization at 2 months. So option C is the correct answer. Social smile at 3 months is the correct answer for these questions. Which of the following is the most common cause of short stature in child? Option A, hypothyroidism. Option B, constitutional developmental delay. Option C, growth hormone deficiency. Option D, psychosocial disturbance. So for these questions, option B is the correct answer for these questions. Constitutional developmental delay. So mainly, short stature is said to be present if the height of the child is below third percentile. That means the height of the corresponding age is less than 2 standard deviation. Okay. So constitutional development delay is a significant cause of short stature in mid-childhood period. Short stature can be proportional or disproportional. So that's why the option B is the correct answer for these questions. So next comes to the question number 9. Asperger's syndrome is a option A metabolic disorder, option B neuromuscular disorder, option C degenerative disorder, option D is the developmental delay disorder. So option D is the correct answer. Asperger's syndrome AS refers to a developmental profile within the autism spectrum disorder, that is ASD. So mainly in this disorder the child can face difficulties in social interaction and communication along a restricted repetitive behaviors or intense interest. Then comes to the question number 10. Taste perception of a baby develops at option A birth, option B 3 months, option C 6 months, option D 8 months. So taste perception of a baby develops at birth. The correct answer is option A birth. So mainly a newborns are born with odor and taste preference acquired in the mother's womb from the smell and taste of amniotic fluid, which is influenced by what mother eats. So that's why the perception of the baby develops at birth, the taste perception. Okay. Then comes to the question number 11. So what does it mean when a baby has 25 percentile of head circumference? Option A is the 20% of children will have head circumference more than that. Option B, the child is having 25% of the normal head circumference. Option C, 25% of the child will have head circumference less than that. Option D, the 75% of the children will have head circumference less than that. So option C is the correct answer for these questions. So 25% of the children will have head circumference less than that. So mainly percentile is a number where a certain percentage of scores fall below that numbers. If a child has 25 percentile head circumference means that there are 25% of the children who has head circumference less than that. Okay, I think everyone understood. Then comes to the question number 12. So during the first year after birth, an infant's birth weight normally, option A quadruples, option B doubles, option C remain stable, option D triples. So this question is basically from the growth chart. So in this question the option D is the correct answer for this question. So at the first year of the first year after the birth of a infant, the weight is normally triples. Okay, so option D is the correct answer. So next comes to the question number 13. Expected weight of 1-year-old child when the birth weight is 3.5 kg. So if the child's birth weight is 3.5 kg, so at the age of the 1 year the child's expected weight is how much? So option A is the 7 kg, option B is the 6 kg, option C is the 9.5 kg, and option D is the 10.5 kg. So here the correct answer is the 10.5 kg. How? Okay, so if the child's birth weight is 3.5 kg, then triple means we need to multiply with the birth weight into 3. So 3.5 into 3 equals to 10.5 kg. So the correct answer is the 10.5 kg in 1 year. So next comes to the question number 14. Which of the following best describes typically annual growth during the school age years? So I repeat, which of the following best describe Typically annual growth during the school age years. Few physical differences are noticeable between the age mates. Option B is the fat pads increase in number and add a chubby appearance. Option C, child grows an average of 2 inches per year. Option D is child gains an average of 3 pound per year. 3 pound equals to 1.4 kg. 2 inches equal to 5.2 centimeter. Okay. So option C is the correct answer. So typically annual growth during the school age years is best described that childs grow an average of 2 inches per year. Okay. Next comes to the question number 15. So growth chart is used for the growth monitoring, for diagnostic tool for action, or all of these. So option D is the correct answer. We can use the growth chart for diagnostic purpose also, for growth monitoring also we can use the growth chart. So next comes to the question number 16. Growth chart is also known as New Ballot Scale. Option B, Road to Health Chart. Option C, Apgar Score. Option D is the GCS. So option B is the correct answer. So growth chart is also known as Road to Health Chart. Then comes to the question number 17. Okay, identify the correct statement among these following related to weight of the child. So we need to identify the correct statement for this from this following. So normal birth weight of an Indian child is 2.5 to 3.5 kg. Then option D is the baby's birth weight is doubles at 5 to 6 months of the age. Then option C, baby's birth weight triples at 1 year of the age. So as we know, the birth weight of the Indian child is 2.5 kg to the 4 or 3.5 kg. So this is the correct options. Option B is the birth weight of the child is doubles at 5 to 6 months of the age. This is also a correct answer, correct statement. Option C is the baby's birth weight triples at 1 year of the age. So in previous question we have discussed the babies at the 1 year of the first year of the child, the birth weight of the child is triples. So this statement also right. Okay, so option D is the correct answer for this questions. So next comes to the question number 18. So normal chest circumference of a newborn. It's a very silly question. So option only, I think you don't need any option for this question. So directly I am telling the answer. So option C is the correct answer for this question. So 31 to 33 centimeter is the normal chest circumference of a newborn. Okay, so next come to the question number 19. So which of the following is not true regarding the birth weight of a newborn? So from this option, so we need to identify which statement is not correct. So first one is birth weight less than 5% of normal requires investigations. Then typically birth weight is between 2.7 kg to kg and 4 kg. Okay, this is the correct answer. So newborns lose 10% of birth weight by 3 to 4 days. It's a correct option. It's a correct option. As you know, the newborns can lose the 10% of the weight by the 10 days of the life, and again he regains after 10 days. Okay, so newborns gain lost birth weight by 10 days. And I told you that the newborn gains the weight after the 10 days of her life. So from these four options, so option A is the wrong answer for this, or option A is the wrong statement for a newborn. So birth weight less than 5% of normal require investigation. 5%, it's a, it is the answer for this question. So as you know, normal birth weight of the baby is between 2.5 kg to 4.5 kg. So normally newborn often lose around 10% in the first 4 to 5 days after birth, but again he regain it about the 10 to 12 days of age. So if the 5% lose on day of the birth is considered normal and requires no further investigation. So next comes to the question number 20. So identify the incorrect statement related to height or length of the child. Option A, length of the baby at birth is approximately 51 centimeter. Option B, length of the baby doubles at 4 years of age. Option C, height of a child increase till closure of epiphyseal plate. Then D, option D is Rate of growth in height is highest during the toddler period. So for these questions, option D is the correct answer. Incorrect statement for these questions. So rate of the growth in height is highest during the toddler periods is the wrong statement. So at the end of the class, if you found this class is helpful for you, then like the video, share with your nursing friends, and subscribe to my channels. We'll meet again with another important MCQ section. So thank you so much and happy studying.